Hello, my name is Oscar Faulkner, and today I'm joined by Rahma Samow, President and CEO of ClearChoice Dental Implant Centres. Hi. What does it take to turn a fragmented dental model into a scalable end-to-end platform, and why do most fail?
It's a very good question, and ClearChoice Dental Implant Centre is a specialty-led, focused on fixed full arch treatment. So we are very much focused on really treating complex oral care, and really this is at the intersection of not only complex treatment, but at the same time providing a higher patient impact from an outcome perspective. And how we approach in terms of driving a fragmented healthcare model into a more platform, scalable model was we really looked at the outside-in perspective. How are we really making sure as a treatment such as complex as fixed full arch, we provide an end-to-end seamless and frictionless patient journey, mapped with also a really digitized and operationalized workflow that is also helping providers to tackle this complex procedures in a more reliable way. So we did really come from what problems do we have? How are we really going to make sure we provide the transparency in terms of technology, innovation, process, because innovation is one end, but also what you need to really make sure is the end-to-end model within a four-wall, like within the dental center, is completely streamlined. We got the KOLs, the medical board team, to really look at map the entire process. And when we looked at the process, what we realized, there is one aspect that requires digitalization, and then there is the other aspects that really required in terms of how do we smartly do our scheduling process, capacity investments, and removing the redundancy work. So all in all, the focus was higher patient experience and better provider experience, but then really making sure we remove the system from individual base and we build a process that is a system level, really standardized, harmonized versus a heterogeneous process. And rightfully, when you asked why do most fail, what happens most of the time is if we are putting the technology in front versus really understanding the problem we are trying to solve and really getting the buy-in from the clinical team to really make them sure with the data, with the transparency that we have, why are our patients waiting 12 months? Why are we having leakage and cancellation within the treatment process? And how do we really make sure that we provide an end-to-end experience where patient outcome and provider outcome really jointly aligns?
How do you improve patient outcomes while strengthening unit economics in specialty care?
This is a very good question, and this is really something that I say it's not either or, because especially when it takes us as an organization longer time to treatment and we are bringing patients multiple times to our clinic, that is margin erosion. Versus when technology is simplifying this process and removing 3-4 hours within one schedule. With the technology and innovation, we were really able to reduce it 45 minutes. It allows us to do more, but it also allows us to make sure that the patient has the relevant clarity, information, and a better process outcome where they can really follow their treatment pathways versus actually just thinking, okay, I'm going in and the process will take me 12 times and I don't know why I'm coming 5-6 times and I don't know what the next steps are. So we were really diligent how we're designing the system about patient experience and at the same time protecting margin. And at the beginning, it requires you to invest a lot of money in technology, but then we had to look at areas to divest why are we having, for example, 10 vendors for dental implants, or why are we having 5 vendors for lab? Why don't we really focus on the vital key partnerships that is actually helping our scale and the quality of outcome what we need? And some of the things we reduced it because we didn't need it. Yeah. So we really looked at about putting the patient at the center of our thinking and doing, and how do we really make the model much more tighter, much more efficient, and not like really chair-based versus outcome-based. So that's how we really focused on focusing on outcome versus prolonging processes. Yeah.
What does real integration of clinical care, operations, and technology look like? And where is it delivering impact?
This is, I think, something that all healthcare providers are really challenged with. How do you bring operational team and the clinical team together in terms of really designing what is the best patient pathway? And technology, for me, is an enabler. It's a means to an end. Because what was really important for us as an organization is what the problems are we trying to solve, and how are we trying to solve, really putting that the clinical care in the front and center. So one area that I can very fast mention is in-center innovation. You come in as a patient, you see your, you go through the process, you see your smile design, you see your diagnosis, and everything is connected. And then you come from the pros exam, it's also again digitalization. We have in-house labs where we can print immediately for the healing set, the provisional set, within the lab. And all this process used to take about 6 months, now it takes 3 weeks. Because we came from problem solving and technology was just an enabler, a means to an end. We never really sit down and say we want to introduce a new AI tool or we want to introduce a new technology, but what we're thinking is like, what problem are we solving? And in order for us to help solve this problem, what processes, what capacity, and what technology do we need? So, and that is how we ground everything around problem solving, rather than there is a new AI, there is a new technology. So very much of the vital few and very much of patient focus, treatment outcome, treatment pathways, and really results. That's how we are positioning within the clinical community, and that is helping us to talk about technology, but mostly what we talk about, how do we really make sure you as a patient does not need to sit in our center for 4 hours for your final impression? How do we take it to 45 minutes so that you can go on with your life? So that's like the philosophy that we are working around at ClearChoice.
Fantastic. Thank you very much.
Thank you so much. Yeah.